everything is working properly and to see if everything looks normal. Do you have any questions for me before we start?
Nope.
Perfect, sounds good. Okay, so as we go, I will just go ahead and explain step by step what we're doing. So first, right now, I'm just gonna go ahead and put my gloves on, and then we're gonna assess some facial structures at rest.
Perfect.
Okay, so right now I'm just looking at symmetry. Everything looks good, everything's symmetrical. Can you open your mouth for me? Perfect. Okay. Now can you bite down? Looks good. And can you tightly squeeze your jaw? I'm just checking to see how those muscles feel when you're tensing. Everything feels normal there. And now I'm also gonna go ahead. Can you close your eyes for me? And I'm gonna try to open your eyes.
Okay.
Is there any pain, any discomfort when I do any of that?
Nope.
Perfect. Okay. And now what we're gonna do, we're gonna look at your lips. Can you go ahead and pucker like this? Make a kissy face. Okay, perfect. Now can you go ahead and smile for me? Looks good. Now we're gonna go ahead and then switch those two and say ooh, ee, ooh, ee. And we're gonna do that 10 times.
Ooh, ee, ooh, ee, ooh, ee, ooh, ee, ooh, ee, ooh.
Okay, and now I want you to go ahead and say Okay, and I'm gonna hold my hand in front of you as well. This is just a check to see if there's any air leakage and make sure that that's functioning properly as well. Now, I want you to go ahead and smack your lips 5 times. Perfect, everything looks good there. Now we're gonna go ahead and look at your jaw. And we're gonna see how it opens and closes, and I'm also gonna palpate it one more time. So could you go ahead and open and close? And now you're gonna do it with the pressure of my hand.
Okay.
And is there any pain when we're doing that whatsoever? Perfect. Now I'm gonna go ahead and have you bite down one more time.
Okay.
I did it a little earlier. Just want to make sure that everything feels good and normal. And no pain when you're doing that, correct?
Nope.
Perfect. And now, could you go ahead and move your jaw forward like this? Can you move it back? And then can you move it side to side? Any pain when you're doing that whatsoever?
Nope.
Perfect. Okay. Now we're going to go ahead and look at your tongue to once again just make sure that everything looks normal to see if it's functioning properly. Can you go ahead and stick it out? And then bring it back in. Perfect. And now, can you stick it back out? And then we're going to move side to side.
The tongue.
Can you do it a little faster? Okay, everything looks good there. And now, can you move your tongue up? Can you move your tongue down? Perfect, everything looks good there. And now I want you to bring your tongue up to your palate. It's that kind of hard, soft part of the mouth up there. And can you click it like this? Perfect. And now, can you go ahead and lick your lips in both directions? Okay. And was that uncomfortable? Did that feel normal? Okay. Looks good. Now we're going to go ahead and then move on to your cheeks. Can you go ahead and puff up your cheeks? And I'm just going to go ahead and feel. Perfect. And now I'm going to go ahead and put my other glove on. And what I'm going to do is I'm just going to press against your cheeks to make sure that there's no air leakage. And everything's working fine there. Can you go ahead and puff up your cheeks again? And I'm just going to try to press against to make sure that there's no air coming out. Perfect. Now, what I want you to do is move air from one cheek to another, like this. I'm going to check once again, just to make sure that there's no air leakage. Perfect, everything looks good there. Now I'm going to go ahead, I'm going to take one of my gloves off and make some quick notes. And we're going to go ahead and look at your dentition. So I'm going to go ahead
What's
And
my
then-
dentition?
So we're looking at your teeth to make sure that everything looks normal, everything is once again functioning well there.
Okay.
We're also, when we're looking at your mouth, we're going to be looking at that palate, that top part once again.
Okay.
And then we're going to just see if that moves correctly. So
Okay.
could you go ahead and then just smile for me? Now open your mouth. And like I said, I'm just looking to see if everything looks good. If everything does. And now I'm going to go ahead and then use a tongue blade. Sorry, these are kind of hard to open sometimes. And what we're going to do with this, I want you to go ahead and stick out your tongue. I'm going to insert it, and then I'm just going to look at your palate. And we're going to do a few things to make sure that everything is working well there.
Okay.
Okay, so could you stick out your tongue? And then we're going to hold down your tongue and look up at your palate. And then can you say ah, ah, ah for me?
Ah, ah, ah.
Beautiful. Okay, everything looks good there. And now we're going to do it one more time just so I can look at symmetry and height and make sure it looks good. Okay. Now what we're going to do, we're going to do some tongue exercises to make sure that your tongue is strong and functioning properly. So what I'm going to do, we're going to put the tongue depressor on your tongue again, and I want you to push up against the tongue depressor, and
Okay.
I'm going to push down.
Okay.
Push it up. Okay, perfect. And now we're going to do the same thing, but with the sides of your tongue. So you can try to push left and right.
Okay.
Let's push right. Perfect. And then push towards your left. Oh, sorry. Okay, everything looks good there. Okay. And now, while we're also doing this, I'm just going to go ahead and check your gag reflex. I know it's a little uncomfortable, but it'll be totally quick. And if you feel uncomfortable at any point, you can just go ahead and let me know.
Okay.
So I'm going to put the tongue depressor on your tongue and slowly move it back until I hear a gag.
Okay.
Okay. Perfect. Everything looks good there. Okay, and now what I'm going to go ahead and do, I'm going to go ahead and touch your face with a swab just to make sure that the cranial nerves that help with our facial function, that prove that you feel everything, that everything works well there. So I'm going to grab a cotton swab and I'm going to touch the inside of your mouth in 4 different areas. And then we're also going to do the outside of your face.
Okay.
Can you open your mouth? And you tell me if you feel everything.
Mm-hmm.
No pain, nothing.
Mm-mm.
Perfect. And now we're going to use a different one for your face. And you tell me if you can feel.
Mm-hmm.
Perfect. Sounds good. Now we're going to go ahead and move to your, we call them assessing vocal qualities. I just want to be able to make sure that you can say sounds correctly. I'm looking to hear if there's any nasality, which would affect your speech. If you have any questions about that, let me know.
Okay.
So first, I want you to go ahead and make the sound pa, and we're going to do that 16 times.
Okay. Pa, 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 pa.
Perfect. Everything looked good there. Now we're going to go ahead and do the same with ta.
Ta, 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 ta.
Perfect. And now we're going to go ahead and do the same with ka.
Ka, 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 ka.
Looks good. And now it's going to get a little trickier. We're going to do pa, ta together 12 times.
Pa, ta, pa, ta, pa, ta. Pa, ta, pa, ta, pa, ta.
Perfect. Everything looked good there. Now this is the hardest one. We're going to say pa, ta, ka 8 times.
Okay.
As fast as you can.
Pataka, 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 pataka.
Perfect. Okay, and now all we have left to do is I'm just checking your voice quality again. Could you please cough for me? And can you please clear your throat for me? Okay. Everything looked good there. Is there any questions you have for me by any chance?
Nope. Does everything look good?
Everything looked perfect. I didn't see any abnormality. Everything looked normal and everything looked like it was functioning perfectly.
Okay, good.
Okay. Thank you very much for coming in today.
Thank you.